The following portion of Indy Now is sponsored by our friends at American Senior Communities.
Welcome to Chad Miller from ASC and nurse practitioner Kacy from OrthoIndy. They're here to teach us how they're helping seniors with osteoporosis in our community. Thank you both for being here.
Absolutely. We're glad to be here. Thank you.
Osteoporosis, we were just saying, it's something we hear about a lot.
Yeah.
Yeah.
You know about it. You might have had a family member affected by it, but we don't really know exactly what it is or how it's treatable.
Yeah.
So, Kacy, that's why you're here. Before we dive in, though, to that, Chad, tell us about ASC's Wellness Wisdom Library of resources online.
Yeah, absolutely. So ASC, we're the largest senior living provider in Indiana. So we want to start this Wellness Wisdom campaign to obviously educate seniors across the state of Indiana and provide these online to be able for seniors to go on and hear more about some of the things they might be facing.
That's great to have those resources.
It really is. Like you were just saying before, knowledge is power.
Yeah.
So this is an opportunity for people to learn more. So Kacy, now that we have you here, give us an overview of what osteoporosis really is and how serious that condition can be.
Sure. So it's known as like a silent disease because it's something that technically it causes your bones to be soft, fragile, weak, and then they can fracture or break.
Okay.
But unfortunately, we don't feel our bones, and so we don't feel if they're strong, we don't feel if they're weak. And oftentimes it's not diagnosed until one has a fall and a major fracture.
Right.
So that kind of goes into the seriousness of the disease, and oftentimes it's our elderly population that are falling and having these fractures, and then they're, more susceptible or vulnerable to having complications after those fractures happen, such as, simple as like a heart attack or a stroke, which can be very, very serious in that population. So, it is not considered something that we see or feel, but it's very serious.
And how is it treated? I mean, is it treatable, and if so, how?
Yeah, it definitely is treatable. We should take more of like a multimodal approach, which is something that we, take multiple, treatments and put them all together rather than just like one medication or something like that. So it can be treated with specific, pharmacological medications, diet, exercise, lifestyle. So it's definitely something that takes more than just one thing to treat and optimize.
We were just talking about the importance of strength training in another segment that we had on the show, but just getting your body armor tight so as you do age, making sure that you're taking care of all of your structures in there. I
know, because that's the thing. You don't want to wait until it's too late, and then you wish you'd done things differently. So speaking of that, is there anything people can do with maybe testing or maybe finding out more?
Definitely, just talking to your primary care provider about just getting a simple bone density exam, which is something I describe to patients as just like a fancy x-ray machine. It's no pain, it takes 10 to 15 minutes to get done, but also understanding risk factors too. Maybe you have a family history of osteoporosis. Unfortunately, Caucasian females are more, they have more of a risk. Elderly, over the age of 65. If you ever fallen and had a fracture after the age of 50. So unfortunately, kind of going back to the seriousness, it can, it's actually more prominent than heart attack, stroke, and breast cancer alone for females.
Wow.
So,
Thank you for that helpful information.
Absolutely. So, diet, exercise, talking to your family provider about just getting tested if you feel like you have those risk factors, even if you're just over the age of 65.
Sure.
Never hurts to have a baseline.
Good peace of mind to have.
It never hurts to learn more, that's for sure. And that's a big reason why you are doing these educational segments.
Yes.
So how can people learn more about the information that you have?
So we're going to have this on asccare.com. So go on ASC Care, and we'll obviously have this segment posted, and as long as other educational topics that we're posting online as well.
Awesome.
Great, thank you.
Chad, Kacy, thank you for being here today.
Thank you
so much. We appreciate it.
You bet. The preceding portion of Indy Now